hold
So
them
this is
upside
the
down.
white
your
fish
cap,
number 7.
and then push your prime. Then you've got all 3 of them in your hand, and you just fill 1, fill 2, fill 3, and then slide that on.
Okay, makes sense now.
Okay? Yeah, I know. It didn't make sense to me either when I started doing it.
Look at the light, a bit of pressure. This is the freezing. It bites a little bit, that one.
That way you don't spill too much, a little bit, but not bad.
Yeah. You notice I'm flowing the injection here, but it goes all around, and this part improved with that. So,
Then you can just
this is the idea of injecting under the iris. So it goes on the
over your table.
sulcus and goes all around.
Oh, you dropped something.
I did?
You missed something.
Cotton tip, is it?
Yeah,
Q-tip. She's a cotton tip police.
She's on you.
Yeah, she's always the cotton tip police. And even tried to hide it underneath the microscope, she still found it.
Alright, Nick, I'm coming your way. Okay? Now remember the order that he's going to go in, so you want to set your stuff up here. This you don't need until you fold the lens, so we can do that later. Okay? Put that here. Scissors to cut the drape. Speculum goes in the eye. The big round guy goes before the blades. Then your blades, then your locals, then your endocoat, then these other 3. The small circle, this, and this.
Small circle.
Okay?
Circle.
You okay? Okay. Left or never? Always top. Yeah. Like an L.
This is a J one.
That's the J.
Open first.
I can open it and slide it in. I never open it.
Did you all check the tables?
Yeah, leave the plunger out of both of those, and then put this with it, so that you remember the 3 go together, and then flip them all upside down, attach that, and then fill them 1, fill 2, fill 3, and just slide that on, okay? All good. All good, okay? I'm gonna go back to my side.
Need a spare or no? Does it need a spare or
Hang on to them. He usually does need some. I used to, for a long time, I put like 2 out just at the end, but he never uses them, and then I just have to throw them out, so. So now that I come back to my side, I can touch this stuff now. I can't touch your stuff once it's been in the eye. So I'm just going to clean up all the things that he's done with to make my turnover a little bit faster or smoother. Because the only things he's going to want now are his J cannula, the Helon, the lens, the hydrodissection cannula again, and his antibiotics. That's all he needs at the end. Yeah, so that's what he'll use right after the pickle. That's our J one that we filled. And we were gentle not to bend it into an L. So 1.8 was the time. I'll switch it to IA and switch this over. And not just eyes, but when you scrub on anything, think of the order that you're going to need stuff in, because some days you're going to be in an awful hurry. If they come in with a 1A stat, something or other, just always in your mind when you're setting up, think of the order that you're going to need it in, because you don't need to set up your dressing and the stuff you need at the end at the beginning. You'll need that time, like the time's valuable, even if it's just a few seconds. So like first things first, they're gonna need to prep. Sometimes they need to put a catheter in. Make sure that's set up. Surgeon comes in, you're gonna need gown, you're gonna need gloves, you're gonna need drapes. Then you're gonna need your cautery, your suction, and whatever. All that stuff is ready to set up first. And then your blades, then your forceps, then your hemostats. The other stuff can wait, but that's your stuff you're gonna need in that order right off the hop. Now for this, it's not like you're in a rush all day in here because you're doing so many, but just get used to doing it in the same order all the time. Very, very routine, very... It doesn't seem like a lot, but if you can shave 10, 20 seconds off of this, off of that, it'll make a big difference. Like, it'll just give you a little bit of time to breathe whenever you're in a big hurry. So that 1% of the time I said you'll go back, you just did. So maybe that'll be the only time. We'll see. And that's it.
They're all done. That's it. One down, one to go.